Okay, I believe we're ready to get started. Ian? Good evening, everyone. My name is Gary Ligori, and I'm the Dean of the College of Health Sciences at the University of Rhode Island. Thank you all for joining me tonight as URI, the URI Academic Health Collaborative, and the URI Interprofessional Education and Practice Initiative sponsor the fourth in our series of COVID panel discussions. Tonight's title is Caring for the Caregivers, as we'll explore issues around stress and stressors that caregivers are addressing today. However, before we begin, there's two things. First, as an audience, if you have any questions you'd like to ask, please use the chat feature or the Q&A feature. I think it's a chat feature, I'm sorry, at the bottom of your screen. Second, I would be remiss if I did not acknowledge the work of the people behind the scenes that make these panel discussions possible, starting with Mr. Ian Lester, our IT person, who's also the head of IT for the URI College of Pharmacy. Also, Mr. Patrick Luce, the communications director for the Academic Health Collaborative, who helps ensure that advertising and marketing for these panels discussions are far and wide. Ms. Barbara Sweeney from the URI College of Health Sciences Gerontology area, who's helped to coordinate many of the logistics and develop the panel questions. And last but not least, Ms. Elizabeth Roberts, who's the director of the URI Academic Health Collaborative, and whose vision and determination have made these panel discussions possible. Thank you, Ian, Patrick, Barbara, and Elizabeth. Again, tonight's title is Caring for the Caregivers. As I noted earlier, this is the fourth of our panel discussions. Previous topics were frontline workers, the impact of COVID on older adults, and health disparities during COVID. For those of you who've had the pleasure of enjoying our past panel discussions, you'll recognize that the stress of being a professional caregiver during COVID was an issue expressed across all of our past panel discussions. Therefore, we felt the need to bring that issue to light. And tonight we have with us 5 members of the Rhode Island healthcare workforce that are here to share their stories with you. So let me begin by introducing our panel. First, in no particular order, we have Dr. Virginia LeMay, who is a clinical associate professor in the URI College of Pharmacy. Dr. LeMay precepts students in ambulatory care and community pharmacy-based clinical rotations and maintains practice sites at Walgreens Pharmacy and visiting nurse home and hospice. Dr. LeMay's recent research has focused on stress reduction and mindfulness for students using meditation and yoga. And Dr. LeMay is an alum of the URI PharmD program. Next, we have Gina McClure, who's the coordinator of the URI Couple and Family Therapy Clinic. Gina oversees services to hundreds of individuals, couples, and families each year. And she also serves as a clinical supervisor instructor in the Couples and Family Therapy Graduate Program in the URI Department of Human Development and Family Sciences, of which Gina is also an alum. Gina herself is a licensed marriage and family therapist. Next, we have Dr. Alish Klein, MD, who is the medical director of the COVID-19 unit at the Rhode Island Department of Health. Dr. Klein is a pediatrician by training and has also worked in private practice for many years. Next is Nicholas Fitzgerald, who is a certified community health worker at the Rhode Island Parent Information Network. Nick serves as care coordinator and specialist for screening, brief intervention, and referral to treatment. There's an acronym for that, but none of you would know that. Nick has been with the Rhode Island Parent Information Network since September of 2019, and he works primarily with older adults and all facets of their health and wellness. Finally, last but not least, we have Laura Guillen, who is a registered nurse on the Med-Surg unit floor at the Rhode Island Hospital. Laura just told us that she's only been working there for less than a year, and she is a graduate of Rhode Island College and a Rhode Island native. Thank you all, panelists, for giving time tonight to share your stories. We're also glad you are here and very much look forward to tonight's discussion. There are many places we can start this discussion, and all would be of high interest to our audience. Therefore, let's begin with a question, or more importantly, a story. Can you share one story that exemplifies your overall experience of what the challenges are like being a healthcare worker during COVID. Laura, I'd like to start with you, since we hear so much every day in the news about the stress that nurses are experiencing.
Thank you. So I think what my personal experience would be just the understaffing. The understaffing really makes you have to wear a lot of hats during one shift, especially with the no visitor policy of the virus. You know, in the midst of everything that you're doing with coordinating with the doctors, the social workers, you also have the families calling a lot. You also have to take care of them in every way possible. Most people can't do their care for themselves. So then you're partnering up with the CNAs so that you can make sure that they're okay and have everything that they need. And then you're acting as a family member for them, especially for me, since I'm bilingual. A lot of my Spanish speaking patients really feel alone while they're there. And I kind of have to act as a family member as well while I'm there. And I have to get on the iPad and get on the Zoom calls. And I'm generally one of the last people that people see once they, go, and to have to experience that and then go and figure out, who's coming in for staffing for the evenings because we're short, it makes you change a lot of modes during an 8-hour shift alone.
Laura, you started by saying that you have to wear many hats, but prior to going live here, you were telling us privately that you literally have to wear lots of PPE gear.
Oh.
How does that add to your personal daily stress?
To be honest, during the first wave, when I saw everything going on in China, out of the US, I was, thinking, that would never come over here. And I would see the nurses in Italy wearing the PPE. And I was like, oh, we only wear that when, patients have a serious virus. And to be honest, the first wave, just putting it on in general was just very nerve-wracking. I can vividly remember the first time putting that on, knowing that I was going into a room with a positive patient, and just literally just shaking, just trying to put my gloves on, just shaking. Like, I just pray that I don't bring this home to my family. And this was just in the beginning when we didn't know anything really about the virus. So, as soon as the months came by, it just became second nature. So you just go in, you put on your PPE. At first you weren't really able to breathe with the mask, but then your lungs literally just adapt to it, and you put on your stuff, you clock in, and you get your assignment, and you just get it done at this point. Yeah.
Thank you, Laura. Nick, you work primarily with parents and adults. So you're seeing it from a little different perspective maybe than Laura. Can you tell us a little bit about maybe a story that exemplifies your experiences?
So working with the geriatric population of Rhode Island, who are Medicare, Medicaid, which is also known as a dual eligible insurance client. Some things that even just as simple as getting some dental work done. I just had a client that kind of went about 3.5 months without being able to get any kind of dental work done because the dental provider was understaffed. So that's kind of going off of how Laura was saying, the understaffing it's tough right now with that. And the client had an outstanding bill because something ended up happening with some of the items on the list for the claim, and the client had like an outstanding bill of $1,800. So now the clients that I primarily work with, they're on Medicare, Medicaid, and they're either on Social Security or they're just trying to pretty much get through life without having to worry about any insane, crazy bills that are coming. So like an $1,800 bill pretty much almost put this person having anxiety attacks all the time. And it's just rough seeing somebody go through that. And then once the place finally, actually a week ago, ended up getting a call from the place saying, hey, we've known that you've tried to call many times. And then after 3.5 months of thinking that, hey, this bill might go to collections because we can't get this figured out, it ended up getting cleared because everything was submitted the proper way and the place ended up getting staffed properly. It's really tough out there, and it's upsetting to see what some people are actually going through.
So that's difficult, no doubt, for the patient, and hopefully a one-time situation for them, but you have to probably deal with that with each and every patient.
Yes, indeed. Every single time there is anything that could possibly go wrong. If something happens with Medicare, if they get a letter in the mail stating that they need to send paperwork back in the next week, and I can't be there to be present with them, and I have to be there to fill out the paperwork with them, that can put a damper on a lot of things. So I've tried my hardest to, I have a very technology-based background. I love technology. So trying to walk some of these clients, they have smartphones, walk them through doing like FaceTime or Skype or even Zoom if they have that possibility, just to get them to do a video call so I can actually see that paperwork that they're talking about physically, and then able to kind of help them through some things.
Sure. Thank you, Nick. Dr. Klein, as the medical director of the COVID-19 unit for Rhode Island, I'm sure our audience is quite curious about your perspective and how you see this, and maybe share a story that exemplifies your work.
Sure. I want to piggyback on what's been said already, that the scarce resources in terms of the people and the expertise has been just an overwhelming theme for us at the Department of Health. I think that state agencies sort of run lean, despite whatever anyone thinks. For physicians at the Department of Health weren't enough before the pandemic, and they're not enough now. What's also been a challenge is not only internally having the staff and expertise to handle, case investigation and contact tracing. We quickly maxed out on our internal resources, probably within the first few weeks, and so then became dependent upon other sources of staffing, which presents huge challenges. You don't have history with working with people. You don't even know who people are or where they're from and what their background is. And you never get to meet them because everything's done electronically. And then there's the challenges around helping to support the staffing and resources outside of the Department of Health. So to Laura's point of, nursing and other staff shortages, PPE, in the past 9 months, we've evolved. In the beginning, it was a very helpless feeling with not being able to procure the supplies that people needed to feel safe in their jobs, to protect them in their jobs, not having anything to prevent this illness, like a vaccine or a treatment. So we've certainly come a long way, and we've seen some bright spots in some developments there. But I will say that it's just been a challenging spot to be in because, as physicians and as public health folks, we're doers, we're problem solvers, we're fixers, and to not have the tools you need to help, fix all the things that you need fixing has been really
no doubt a challenge. Yes, thank you. I'm going to move on to our next question, but remind the audience that if you have any questions for us, use the Q&A feature at the bottom of your screen. So our next question is this: now that we're experiencing the predicted fall surge in COVID cases, and with winter and the holidays right around the corner, although some would say winter started this morning, what are your fears about your work, and or what reassurances about your work do you have? Gina, you run a large clinic, supervise clinicians and students, not to mention you're dealing with families every day. So you see the firsthand effects on this in everyday life. What fears or assurances do you have?
Thanks, Gary. So I get to see several different layers of perspectives. As a supervisor, I supervise therapists, graduate student therapists who are working with a number of clients. I also have my own personal clients. So I see clients from that personal view, and then I see my supervisees who are seeing clients. And with that, what I would say when I think about us going into the winter and my fears as we're going through this together is that there is not as much ability to manage the way we have been. You know, we've adapted really well. And I think when I say we've adapted really well, some of the ways we've adapted is we've moved everything outside and we've encouraged people to go outside. And this is a topic of self-care, this panel. And what I would say is a big part of self-care for people has been being able to go outside. And it's not just about being in touch with nature and getting sunlight, although that's incredibly important, but it's also about how we can see others and not be isolated outside with social distancing. And as we go into the winter, my fear is for my clients, for the people that I supervise, and for friends, myself, everybody, is that we won't have that ability as well. You know, it's colder and it's not going to be as easy to eat outdoors or meet up social distance outdoors, or have clients get out for a walk, get exercise, get moving. So that's one of my biggest fears, because that becomes isolation, you know, and as the days are darker, there's already seasonal affective disorder. People feel more depressed. Holidays are stressful for people, but particularly now, you know, we're seeing people who really are having a tough time that their Christmas isn't going to be the same, you know, either because they're grieving and they've literally lost a family member, or because they had planned to see their family across the country and they could no longer go, and it's been forever since they've seen them. And what if that family member died of COVID or not COVID? Will they ever see them again? You know, even if they're not sick. So people are getting through the holidays is going to be a thing we need to overcome. Getting through the winter is something we're going to need to overcome. When you
Jeannie, let me ask a question, Jeannie, as a supervisor of students. So you're talking about a lot of your clients, your students who are learning to be caregivers. This is quite a trial by fire for them. And as we come up on the semester break, as many of you remember, those of you who've been to school, it's a time maybe to relax, reset, and get ready again. How do you suspect your student trainees are going to handle this downtime, if there'll be any? How will it impact them?
So our clinic is closing for 2 weeks, and so there will be downtime. And I actually talked with my students that I'm supervising about this in preparation for the panel, and they are very much anticipating and looking forward to this 2 weeks off, because they are go, 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 as all caregivers are at this time. You know, the demand is very high. There are clients that need to be seen. So having this forced break that we have provided for them, where they're not even allowed to see clients, is an effort to get them to take some time for self-care and to force them into that. And they thanked me for making it a forced choice, that they have to take time, because what I know about caregivers is that they care, and they're just going to go and go and go and go and go on caring for people until they drive themselves into the ground.
At their own expense, yeah.
At their own expense. So they are very much looking forward to that.
Thanks. You're answering a future question too, so thanks. We'll get back to that. Dr. LeMay, you have a similar role to Gina, that you supervise students. You're out in the field. What's your perspective on this same issue in terms of fears and reassurances?
Right. I'll reiterate what the other panelists have said, especially what Gina had said. Our pharmacy students are exactly the same way, and pharmacists in general, like many of those on the panel, we are just givers. We, like Dr. Klein had said, we just want to solve problems, take care of people. We've actually had a very interesting year, COVID related. Not only have we had an unprecedented amount of patients to care for, as well, we've actually found federally that our provider status, if you will, has expanded. So what we were doing already, we continue to do, and then they gave us more patients to care for. So one of the expansions was the ability to provide pediatric immunizations down to age 3, which, depending on state regulations, it was really only down to age 9. Well, that's a whole different little subset of patients now that we're caring for, that we need to make sure that we're practicing at the top of our license. And that goes not only for pharmacists, but for pharmacy interns and now pharmacy technicians with certain training in the state of Rhode Island and other states as well. So we've not only been doing what we've been doing, but we've been learning new skill sets. I fully recognize that we have a lot on our plate, but I'm actually very optimistic with the COVID-19 vaccine, which as of yesterday is already starting to protect people throughout the world. So in the UK, the first patient was immunized. And we fully expect, like Dr. Klein said, for the FDA to grant emergency use authorization for the first one in the US tomorrow. So this is a major step towards change. So I think
that has
that
many people optimistic, doesn't it?
Oh, yes. Yes. And I think that although, yes, we are all feeling that caregiver burnout, I think I can speak for most of us to say we're also very energized by the work and being a part of the positive change. And it feels really good to be able to be a part of those next steps.
Great. Thank you. Next, I want to ask about teamwork. So Gina, Dr. LeMay, Dr. Klein, you all are in some way, shape, or form in supervisory roles. Laura, you probably are a part of a team in everything that you do. Nick, I suspect maybe you work a little bit more solo, if you will. So teamwork looks different for all of you. Some encourage it, some are part of it, maybe some wish you had more of it. We've seen so many heartwarming stories in the news about healthcare and public health practice, where sometimes unexpectedly teams have risen up or individuals have to support one another. So I'm wondering if any of you can share with the audience a story where you or your colleagues or your employers or someone else have offered assistance that's made it easier to cope with the pressures of managing in your day-to-day role. Who would like to go first? Nick, go ahead.
So working, it's kind of like you definitely kind of hit that where it's like you're kind of solo, but you also kind of still work you work with a team. So we're able to contact any member on our team and just kind of chat with them for a little while. Or if we have like any kind of issues, we usually have like a bi-weekly meeting that we're able to kind of bring our case review to and just review some problems. But I kind of want to focus on the company itself. The company Ripen, which is the Rhode Island Parent Information Network, they have been absolutely fantastic. They have sent out numerous amounts of care packages, and they have silly little things like a little door opener that you wouldn't think you would actually need, so you don't touch any door handles. They sent me a little winter hat with Ripen on it, and they just kind of send all these kind of little care packages on it, and they've made us feel so thought of and make sure that we're all feeling okay. And they try to, even we have a all staff meeting coming up this Friday where we're having something called chair yoga that I cannot wait to see what that's like. And it's just so that we can focus on our mental health and know that we're still cared for by our company. And I honestly couldn't ask for a better company to work for at the moment.
Well, I can just tell by your response, Nick, that really has touched you and goes a long way towards making you excited to go back to work every day. Yeah,
absolutely.
Yeah, Laura, how about as a nurse? I'll get you in just a second, Gina. Laura, how about as a nurse? You're working as a team, I suspect, constantly. What things have happened that have really shown an endearment towards teamwork?
So we do huddles before our shifts always. We talk about patient acuity and who we need to pay a little bit more attention to, and if we have any concerns, we kind of have like an opportunity to talk about it right then and there before the shift gets started. They just started doing like raffles every Friday for like gift cards to like Starbucks and Dunkin' Donuts and things like that, but it's really hard to try to assemble together something for us because we're on a warm unit and a lot of things aren't allowed. So, we want to do a potluck or we want to do things like that, but we just unfortunately cannot. Like before, in the beginning of the first wave, the doctors actually got us a bunch of PVD donuts and was like, thank you for everything that you do and all that. We were like, whoa, the doctors really like us. So that was really nice. But then it came to the point where we just like had to shut the break room down, like period. Like we couldn't even eat in there. So we just kind of like to, exchange numbers, or we text each other, hey, are you doing okay? I heard your patient wasn't doing really well. How are you holding up? So we're definitely, with teamwork, we definitely support each other mentally through that.
So a lot more outside of work, because the nature of the work makes it hard to do, but you're there for each other afterwards.
Right.
Yeah.
And just knowing that you can call someone whenever you need help.
Yeah, that's important.
Enough. And just
Yeah.
being there at this point is just enough, because,
Right.
A lot of people are just not able to because they're sick. There's nurses that are out sick and they're gone for 2 weeks to quarantine. And you're just like, wow,
Right.
I'm one out of 4 nurses that are here with a full patient assignment. So just being there and being helpful and present is enough teamwork right now.
Dr. LeMay, you wanted to say something?
I was going to speak to what we're doing at the college, at the university. So within the College of Pharmacy, we identified actually several years ago that caregivers have caregiver burnout in spite of a global pandemic. So we've been trying to put a concerted effort towards creating a wellness culture within the College of Pharmacy. Healthcare providers in general, as we said, are at higher risk. And not only our students, but also our faculty. So many of our faculty within the College of Pharmacy, like the other panelists here, have practice sites outside of their didactic or their experiential teaching. So we know that there's, I call it the sort of the trifecta. If you're a healthcare provider, if you're an educator, and you happen to also be a parent, you have really, your gas tank might be on empty for the past 6 to 9 months with remote learning for your children as well. But at the College of Pharmacy, we have been doing yoga and meditation offering really for the past 3 years. We've done it, of course, we're professors, so we do it for research, but we also do it for just the general well-being of those within the college. And we found that even just once a week practices, some sort of mindfulness, Gina mentioned going outside. In this case, we were doing yoga and meditation, can have a reduction in stress and anxiety and an increase in mindfulness. And those benefits can be sustained. And they don't have to be fancy practices. They can be very simple. We have a lot of our students, they embrace technology. There's data to show that using Headspace, the mindfulness app, can really make a difference. So we actually created a wellness and resiliency committee within our College of Pharmacy. And every week we send out strategies and suggestions, self-care recommendations, thoughts to ponder, different mindfulness practices that they can try to incorporate into their own lives and then share it with others.
Great, thank you so much. Gina, in your role in the couple and family therapy clinic, you know your students well. Have you seen the students bonding together a little bit more to support each other? Maybe you can share something that you've noticed there.
Yes, definitely. I was thinking about that as Laura was talking, and this came up when I spoke with my students about what helps them to take care of themselves. And one of the biggest themes is this idea of solidarity. You know, the people who are doing exactly what you're doing, if you're connected to those people, that is the strongest thing. You know, like it is nice for the agency and the supervisors to be available and to check on them, but they also really need each other, and they absolutely lean on one another. And the more that the organizations can make that possible and encourage that and allow for opportunities, especially thinking about counselors, like nurses, for example, they may see each other in their PPE and wave at the water cooler and things, but counselors, we're all remote. So it's particularly isolating. You know, they're not seeing each other physically. They're not around one another. And so just making opportunities for them to connect, encouraging them, talking about the importance of them, texting one another and being there for one another. They lean on one another because they can understand and be in unity with one another and get somebody that gets it. You know, that validation is so important because people know exactly what you're going through. That difficulty is acknowledged, the sacrifice is acknowledged. So that peer-to-peer support where they can lean on one another is crucial.
Sure, thank you. Dr. Klein, how about in the Department of Health? What's happening around teamwork that inspires you?
That inspires me. Well, I think it's the relationships that I have with sort of a core group of folks that have worked together closely before COVID, so we have a history, we know each other, we can lean on each other. It's been a real challenge, like I said, with lots of new and different staff coming from very different professions to fill in the gaps that we haven't gotten to know. But I think the core group of people from the department who know each other have leaned on each other. You know, state government agencies don't have the ability to do some of those wonderful things I love right then to show support. There's just, you know, not much in the budget to do things like that. And so, you know, we're definitely we've all been at a breaking point, quite frankly, for a while now. And the thing that keeps us actually, I think, even show up every day is the relationships we have with each other. Because I think many of us are beyond the breaking point, and it's those relationships. And you know, I think in person is not in person is a real challenge, but thank goodness for this technology, because I do think for the people you already had an existing relationship with, it is a good modality to be able to feel connected, you know, in meetings. And good thing about having no boundaries with your hours or or your availability is that you can talk to your colleagues any day and time, and we do. So I think those relationships have really helped a lot.
Yeah, and Gina had mentioned earlier the issue of isolation, which we hear a lot about in terms of individuals and families and patients, but we don't really think about isolation in terms of our healthcare workers. And some of you are more isolated than others. And I suspect even some of you who get to, I don't know if that's good or not, but get to actually go to work, there's still a level of isolation that didn't exist in the past. So I'm wondering if any of you have any stories yourself or coworkers, or what you're seeing about healthcare worker isolation. Go ahead, Gina.
Well, what I was going to say is that in a counselor's situation, you are talking to people and seeing them all the time, and you're often just so busy though that you're not taking the time for yourself. So this is back to the caregiving. So it might not be isolating in a sense, is that you're talking to people, but it is isolating in the sense that you're not physically with them, which is very different. You know, it can be very draining. Imagine being on Zoom all day. You all do it. A lot of people, you know, nowadays that's what we all do, but that's the way that it works for our counselors. So that's the isolation of you're not physically with them, you're burned out on the Zoom. And then also you're so busy just caring for others that it's kind of an isolation that you don't actually have as much of a chance as maybe pre-COVID, and also because of the pandemic and not being able to get, you know, close to people socially, is that you're not connecting as socially. And yes, you can talk on the phone and that's great, but do you have time to talk on the phone? Or are you in that situation where you just got to get up and go to your next shift? And, you know, when you have time, you're trying to sleep.
Right. Laura, did you want to address the isolation part?
Yeah, so even how I was mentioning earlier, we only can have 3 employees in the break room at this point. And even that's a little nerve-wracking, because now you're eating with your mask off, and you know, you're trying to minimize risk of transmission, but you also want to talk to your coworker about, hey, how's your shift going? But you kind of don't want to talk too much because, you know, the risk of transmission is there. And even the isolation with just taking care of the patients. Usually have visitors come, their mom, their son, or someone, especially the elderly that are there, that don't know how to use their phones, and you don't have a contact information. And now you're isolating yourself from being able to take care of this patient that can't take care of themselves. And on a normal day, a family member can just, you know, walk in and say, hey, my dad usually takes this, you know, at night, or he usually does this at night. Don't worry about it. But at this point, it's very isolating, because you kind of have to like read a person and get to know a person within your shift, and kind of cater to them without any help from anywhere else most of the time.
I am hearing also with some things Nicholas said earlier, there's isolation that the healthcare workers are dealing with, but there's also maybe an increased level of frustration because your patients are running into so many barriers that you're having trouble helping them navigate, and that's a double situation. So we do have a question from the audience that seems to fit in here, and let me read it to all of you. How can you manage burnout, caregiver fatigue if you work in multiple clinical or healthcare settings, such as remote work as well as inpatient work with clients in a hospital? So how do you manage caregiver fatigue or burnout? If anyone would like to address that. Go ahead, Dr. LeMay.
I don't think there's an easy answer to that. I think it's something that we're all working towards, but having, as we've mentioned a few times, I look at self-care as a respite to the real world because we are all immersed in caregiving. And by finding some sort of mindfulness practice, I think that those who went into this pandemic without having those sorts of coping skills have found this to be even harder. And I think those who may have had a little bit of a baseline of self-care already carved out into their days, this is a generalization, but what I've noticed with our students and with my patients, and just anecdotally, that those who didn't already have something that they carved out in their life, so maybe that is 2 minutes of meditation a day. And meditation, like we tell the students, that doesn't have to happen where you're sitting in an om, with your legs crossed with candles going. Meditation can be sitting in your car before you get out to go into your shift. It's closing your eyes and just trying to control your thoughts for 120 seconds. So I think that the greatest thing we can do is to actually schedule that time for ourselves, because if we let that needle go to empty, it's a lot harder to get back on track. But if we can at least chug along at half a tank, and with maybe not the greatest analogy, but it is important not only for ourselves, but also for those who love us and who are around us, that we need to take care of ourselves.
Dr. LeMay, thank you for that. Let me segue that right into our next question, which is about self-care, self-support. So those two issues are relevant really to all of us all the time, and things we should be addressing, but oftentimes we neglect because we're too busy or we're helping other people in general. Now, as a healthcare worker, during a pandemic, it seems more important than ever that you're finding time for self-care, self-support. So maybe you can share some stories, any of you, about things you might be doing for yourself. And also, is what you're doing for yourself or you see others doing different than what happened pre-COVID? Laura, go ahead.
So I kind of have like a superficial thing going on here, but something as simple as like, I never used to get any pimples on my face, like ever. And I always used to wash my face, in the mornings, at night. And with the masks now, it's just like pimples all on my chin. It's like TMI, but really, truly, just something as small as that. Now I'm out going and trying like different skincare products. I'm just like, this cannot be happening to me. Like, this is not happening. So I definitely have like upped my skincare routine. And I've made it like a moment where, I get home from work and, and I'm like, okay, I gotta wash my face. And then I gotta, drink some water. Then I gotta go to bed. So it's just, I did it before, but just naturally, but now it's more intentional. I would definitely say it's definitely more intentional. So,
and that also, Laura, highlights that the healthcare worker experience with PPE is probably far, far different than the public. I'm probably as guilty as many people in the public of complaining for wearing my mask for 10 minutes in the grocery store. So I feel quite ashamed now in front of all of you even saying that. So. Other stories around self-care, anything that you might like to share? Nick, go ahead.
So even as simple as something as like I really love the fact that you go out and find new skincare routines and skincare products. I absolutely love that. That is a perfect example of like good mindfulness and taking care of yourself. And it just shows that, even something as like being at home, I have noticed that as I never drink water, so I always make sure that I'm drinking so much water, and I'm trying to make sure that I ended up getting one of those little soda stream things that you make carbonated seltzer water with, and it's simple, and it's just those little things that kind of help. And then another thing that I've done with my husband was we ended up setting, and don't judge me because I know all y'all haters are out there. We put up our Christmas tree and decorations on November 1st. So it's just something, if it brings me joy, why not do it?
Yes, if you can find something. Thanks, Nick. Dr. Klein?
Yeah, I want to pick up on what Gina and Ginger said about having sort of a pre-existing outlet. I think has been really helpful, and mine is getting outside. And I didn't know this until recently when I stumbled upon a Facebook post of my husband's, but apparently I worked for 72 days straight. And that was at a point when I was working primarily, I had set an office up in my bedroom because I had been sick for a couple of weeks. So I was isolating, and then I just extended that. I didn't know that I had been doing that for 72 days. But despite all of that, I got out and walked outside every day. And eventually, I think my coworkers figured out that every day on our meeting from 10 to 11, I was outside walking because they say you need to mute. And people just sort of got used to when certain people would be running and they were in the meeting or walking. But I think that that has probably been a saving grace, is one, that it was something I liked to do and already had anyway, and just second nature, just started doing, and that it is outdoors, to Gina's point, where you just feel a little more natural freedom. You know, when you can find someone else who has that same time, you can get a little bit of that social interaction. So I think that's been, and I actually will do this year round. So I'm one of these people that will do it in winter, because if not, I think you're right, Gina, with the darkness, if you can't get out and get some light and some air, that's a real challenge.
Dr. Klein, can you promise us that you're not still working on your streak of 72 days?
No, it's yeah.
Been tough. Yeah. Yeah. And I think your point about getting outside is or doing whatever it is that helps you is so important. You know, we've heard just as many stories from people who have been able to do those kinds of self-care things and actually improve their health a little bit, but there's just as many who it's gone the other way for them because the stresses are just too much. So all of you in your caregiving positions can certainly help people find that happier place. Gina, did you have a comment?
Yeah, what I wanted to say is that with the pandemic, we certainly have to get more creative about self-care. And I would suggest that people bring it back to basics and redefine what self-care even looks like. So for example, remembering to breathe. I mean, that is self-care, taking a little bit slower of breaths at times. Ergonomics, like making sure that you're sitting in a chair that's supporting your back and your posture. Those little things that we can do. Some people don't see that as self-care. A lot of people see self-care as I have to eat healthy and I have to go on a run. And then that puts a lot of guilt on people. So self-care can be a double-edged sword where people can sometimes, particularly caregivers, feel guilty that it's just one more thing that I'm supposed to be doing and I'm not. So it's about really redefining it, going back to the basics. I liked Nicholas's idea of just something super simple. You know, it can be a very small little thing that just gives you a little bit of happiness and delight that you can relish in just for a moment.
Yeah, and Gina, I think some of your comments speak to what Dr. LeMay has talked about with mindfulness, right? One anecdotal story we're hearing a lot now is dentists are seeing more issues than ever with teeth because people are grinding their teeth at a rate they've never seen before. And so becoming aware of that, or aware of your lack of proper breathing or sitting or whatever it might be, dovetails nicely with mindfulness and just taking that moment to take care of yourself. Dr. LeMay, did you want to add to that?
I just wanted to add, and maybe Gina could speak to this, or Nicholas, that it is important that we recognize or distinguish mental health illness from mindfulness and wellness. So if somebody, and maybe if this is one of the topics for this, if we are identifying in one of our coworkers that they do need services for mental health, whether it's undiagnosed or untreated, yoga, meditation, skincare, all those things are lovely and additive, but they're not a substitute for treatment. So we do want to make sure that we sort of distinguish the difference between those.
Great, thank you. Let me move on to our final question so that we could also save a little time for the Q&A. So here's the final question. Moving forward, and some of you address these challenges, so now I'm going to ask you for the answers because I know you have them. What can be done differently to better support health professionals, especially during a prolonged healthcare crisis? And second, how can healthcare professionals more effectively communicate their own needs? So let me start with Gina and Dr. LeMay. You both work with students. How do you encourage them, maybe differently now, but how do you encourage them to advocate for their own needs as healthcare workers, especially during a crisis?
I think one of the biggest things is to make space for them. People often have a hard time asking for help, and it can be important to make space to check in. And it has to be different than this is our regular meeting. How are you? Oh, I'm fine. Great. Moving on to business. A true how are you is pretty important to make space for that. I think sometimes you have to approach it in different ways. So sending out a list of resources, we sent out a political election stress kit that the counseling center had done, but making the effort to send that specifically to our caregiver people and letting them know we're in a position where I can give my counselor students strategies that would be beneficial for themselves, but also they're going to do with their clients. So that sort of forces them to do it. So here is a great resource to help your clients who are in stress, do it with them, or do it for yourself first and then with them, and then keep it as a resource. So I think we need to think creatively about that, but reaching out, making space for it, doing it often, prioritizing it, and creating that as part of your culture would be what I say is most important. And then just kind of tying together what I had made in that last point is that allowing them to connect with one another. I cannot emphasize how important that is, and reinforcing that that's what they should and need to do.
Great, thank you. Dr. LeMay, can you add anything to that? I'm sure it's similar for your students.
It's very similar, and we focus a lot on our student advisor relationships. So we've been sending out, our wellness and resiliency community has been sending out, as Gina had said, links and resources. We're encouraging people to reach out, trying to meet face-to-face and asking them what's working best for you. So if, in the spring we had to switch to remote learning and we did a lot of asynchronous teaching, students really want to be with us.
Yeah.
And so we're making ourselves available all the time to be connected to them, one-on-one, small group, larger classrooms, hybrid teaching. We're available to help.
Right. Nick, you work with families, individuals, and your role is to help settle them down a little bit and help point them through referrals in the right direction. But what about you and others like you? How can the system support you and your needs?
I guess I've really never put a thought into that. I guess my mind is kind of just always consistently making sure that somebody else is doing okay and that they're at their best health and they're receiving the best health care. So, I mean, I know somebody ended up saying it. I'm so sorry, but I'm horrible with names. And also I know all of your names are there, but somebody said it with, it's kind of just giving them a little bit of space, and it's not a tremendous amount of space, but it's just when you think that if something is time sensitive, just kind of imagine like what behind the scenes look like, because it probably doesn't look cute, and it definitely is a little hectic. And sometimes it's just that little bit of space that can kind of help somebody figure something out and get something done faster.
Right. Laura and Dr. Klein, you're in roles where you're in direct healthcare with patients in hospitals. What about for each of you? What can the system do to better support you? You mentioned earlier, Dr. Klein, just supplies and things like that. And that's an obvious one, but are there other things that the system can do to support healthcare workers?
Yeah, I think we're fortunate because our state is so small, and there are a lot of good relationships between, people that play different but really important roles in the healthcare system, whether the outpatient and primary care providers, hospitals, health insurers, the Department of Health. I think these relationships have really helped us get through. And I've seen some really good examples of, helping healthcare providers be equipped to do more telehealth where that's appropriate. That's been, a huge thing, but it required a lot of interdisciplinary work to your earlier point of making sure that health insurers and patients and physicians sort of had the knowledge and resources, and all the other clinicians who are treating people remotely and having to dive into a whole different kind of work. Having the tools that you need to do that, I think, is one example of people working together to try to support people to continue to allow them to do what they do best, help their patients, help their clients, help them stay connected. So, I think that's been one bright spot. I think, clearly there are challenges, at the national level that maybe will change around just supply chains and resources and those sort of, materials that make a real difference in protecting people in their work and how they can do their work safely. And hopefully we'll see some improvements there.
Laura, as a nurse, are there things you do to advocate for your own needs?
I think just trying not to work too much for myself, knowing that there are available hours, but also saying, you know what, you probably shouldn't do, 40 to 45 hours this week. Maybe you should just let them kind of figure it out this week, because if I'm just constantly picking up shifts and constantly staying overtime, it's going to take a toll on me. So I think that's the best way I can advocate for myself. I remember seeing some flyers up for some mental health appointments that you can make with employee health. But I remember thinking, I don't have the time to set up an appointment, and I don't want to be at the hospital if I really don't have to be, honestly. So right. I think that along with what they were saying, that telehealth would be really helpful in terms of how did your shift go, or how do you feel about your patients? Right. Because I know the managers are busy themselves, and they're usually stuck up in the office, and they're usually gone when things really are going on in the unit. When you have your patient that was perfectly fine yesterday, you have them today, they're on high flow nasal cannula, they're still desatting, and then you had to transfer them to the ICU. But that transition requires a lot of resources and a lot of time to do. Right. And once you're done with it, you still have 4 patients to come back to that are waiting for you. And I think just being able to just pull you to the side and being like, hey, are you okay? Do you need anything? Or, are you all right? Your patient is in the ICU now, would be very helpful. I think along with what Nicholas was saying with the time sensitive thing, it's it happens so often nowadays that you're just on to the next. You don't even have time to be like, wow, John Doe was a really nice guy. I can't believe that, he went that way. And just being able to just talk about it in the moment. But that's when the coworkers come in and, we kind of just text about it, and we're just like, okay, well, all right, well, I'll see you tomorrow. It's just kind of just got to internalize a lot of things and do the self-care and just move on, because if you dwell on it too much, then you're just going to put yourself in a hole, and you probably can't dig yourself out for a long time.
Thank you, Laura. Let me read a couple of the questions we have from the audience. Nick, maybe the first one you can address. It says, older adults are trying so hard to be compliant and be safe. Do we have any positive suggestions for this group on how they can do that without it becoming too stressful?
It's definitely a very hard thing that I've seen with working with the elderly population. It's always barriers that you kind of see up. Oh, I want to go see my grandson. I want to go see them for the holidays. My daughter wants to come over with her new baby, and it's very hard because you just see so much hurt and so much pain and grief. And one thing that I can just pretty much say is, it's really rough, and it's such a redundant thing that's said all the time. Just take it one day at a time and make sure that you are staying safe. Your health comes first because you're one of those targeted populations, and you want to make sure that you stay safe. Make sure you're washing your hands, make sure you have your mask on, and give yourself a break and just take it day by day.
Thanks, Nick. Gina, go ahead.
Just a short thing to add to that, we work with some people that are older in our clinic, and a lot of them were not wanting to necessarily transition over to telehealth when the pandemic hit, but we sort of nudged them and said, you know, come on, let's just give it a shot, we'll help you. And it has been a real lifesaver. So don't rule out the fact that access is greater than ever now. And so people from their own beds can do counseling. So I would encourage all older people, although they might not want to do it in the beginning because of the technology involved and they're just not certain with that, if they just give it a shot, a couple of sessions, that could make a big difference. Because in the past, there were so many barriers about why they couldn't get in, transportation, nursing homes, things, those aren't there anymore. So that's kind of a light spot.
Great. Thanks, Gina. So the last question, Dr. LeMay, you alluded to this earlier, talking about the tank running empty when you are a worker, a caregiver, maybe a parent. How do you juggle your professional responsibilities with self-care, with family, et cetera? Those who care about you outside of work are probably taking a back seat to your job. How do you balance these and make sure you are getting what you need in terms of self-care? So Dr. LeMay, I'm going to let you take that one.
Okay, that's a big question. And again, it's a journey, right? So although I teach yoga, I'm still on the journey as well. I'm still on the path. So I would never say I'm an expert in this area. I know I can speak personally. It's about getting my entire family involved. So we are on this journey together, and whether we are physically together for those that live in my home, or if we're doing it through Zoom, like Nick and Gina had mentioned, we've had so much fun from a technology point of view within our family. We always just say, you know, hashtag silver lining. We're trying to focus on the things and the ways that this has brought us closer together. We've probably communicated more over the past 6 to 9 months than we did before in 2019. So I think keeping the family connected, and also having, for example, I have 2 sons, both teenagers. So a lot of isolation and remote learning, and that's a whole other discussion. But having them involved in the self-care, going for the hike, having them take yoga with mom, having them talk about it, those are all ways that I can balance out work and family and caregiver.
Great. Thank you very much. So this has really been a truly wonderful evening of information, sharing, and storytelling. I think I can speak for my URI colleagues and for the audience in saying how much we appreciate all of you and what you do each day and every day for the health of the state of Rhode Island. Thank you again for your time tonight, panelists, and audience. Thank you also. Please look out for an announcement soon about the 5th COVID panel discussion, which will be on the COVID vaccine, which we will host sometime in mid-January. Good night from the University of Rhode Island, and Godspeed to you all.